So I understand that you and your doctor have made the decision that you're going to have a cesarean birth. Here at the Women's Hospital, we've been working for the last several years to develop and implement an enhanced recovery program for patients having a planned cesarean birth, and it starts long before you have your baby. So we've developed an educational booklet and the video that we're filming today that discusses our program. We've been working with patient feedback, our obstetric anesthesia and neonatal physicians, nurses, lactation specialists, physical therapists, and dietitians. We've developed a program that uses best practices based on national data and individualizes it to our unique situation. One aspect is anemia prevention. During the pregnancy, we've been following you for anemia or low iron in your blood, and we're going to supplement your iron to prevent you from becoming anemic.
Does my prenatal vitamin give me everything that I need?
So your prenatal vitamin does contain iron, and despite this, sometimes patients can still develop anemia. But that's because patients don't absorb iron well during pregnancy, or they don't tolerate it due to symptoms such as nausea or constipation. We can arrange for you to have iron supplementation through an IV or through your vein. Avoiding anemia will maximize iron stores so that you continue to use them to build your baby and still have enough to help you recover and feel better after your delivery. This will also help you be able to take better care of yourself and your baby after delivery. Patients with anemia also have a higher risk of postpartum depression. Also, during the course of the pregnancy, at around the 32nd week, you will have an appointment with the maternal care advisor to review your history. Before you visit, you should decide on pediatric care after you and the baby are discharged from the hospital. The maternal care advisor will ask you who you have chosen. She'll make sure the appropriate paperwork is completed so that when you come in for delivery, everyone will know what to expect. If you're planning to have a tubal ligation, there may be the additional consent form that needs to be completed by around that time. The day of surgery or the night before, if your surgery is early in the morning, you should shower with antibacterial soap. Don't shave in the area of the incision. If you have hair in that area, we can use clippers on it. And you should avoid eating or drinking anything except for some medications for 8 hours before your scheduled delivery time.
Do I take my normal medication the day of surgery?
So if you take medication daily, that's something you should contact your doctor and discuss which medications they want you to take the morning of surgery, and you can take those with a sip of water the morning of surgery.
What all do I need to bring with me to the hospital?
So the booklet that I gave you has a list of supplies to consider bringing to the hospital. Basically, we will provide everything to take care of you and the baby in the hospital, but you may want comfort items for yourself and an outfit for the baby to have photos taken in and go home in. You should also have your car seat installed the day before of the delivery so that it is ready before you're discharged. Now let's go see what happens when you arrive. When you come in for your delivery, we will enter through these doors and check in at security with the admission clerk. Next, we'll bring you into this type of room and place the baby on a fetal monitor and check your vital signs. Your nurse will draw blood and place an IV, which is a tube that goes in your veins so they can give you fluids and medications. An anesthesiologist will come and review your history and discuss your unique situation and develop a plan for your C-section anesthesia. They will order medications to help decrease pain and nausea caused by the surgery. Most patients who have a planned cesarean birth will have a spinal anesthetic, which will make you numb from here down. You will be awake and able to experience the birth of your baby. You will feel pressure when we're delivering the baby, but you should not have any pain. This is an operating room like the one in which your baby will be born. The spinal is placed by sitting you on the side of the OR bed and bending over to expose your spine. The anesthesiologist will clean the area on your back and then place a needle in your back and place a fluid with numbing and pain medication in your back. Almost immediately, you will become numb and will be laid down on the OR table. We'll place a catheter in your bladder to keep it empty and decrease the likelihood of injury to the bladder during surgery. We will prep your abdomen with the antiseptic prep. The one we use most often is blue. So don't worry if you have a big square of blue skin after the surgery. It will wash off with your first shower. It takes 3 minutes to dry, and then we place blue drapes over you and create a sterile surgical field. If you want a drape with a clear window, let us know, and we can use one of those. We will make sure that you have good pain control and that we will get your support person and bring them into the room to sit beside you. Your support person can take photos and video of the baby, so they need to bring their camera if they want to do that. Your doctor will make an incision in your abdomen and then deliver your baby. This process usually takes about 10 to 15 minutes from when the incision is made, but sometimes it takes longer if you have had prior cesareans or other surgeries that can cause scar tissue. After the baby is born, as long as the baby is vigorous, we'll stimulate the baby by rubbing his skin gently and wait 30 seconds to allow the placenta to deliver additional nutrients to the baby before clamping and cutting the cord.
Can my support person cut the cord?
Unfortunately, no, your support person cannot cut the cord on the sterile field as that increases your risk for infection, but we can leave the cord long so that we can have your support person trim it at the warmer for a photo if you want. We will then briefly bring the baby around the drapes and show you the baby. It is important to keep the baby warm, so then we'll take the baby over to the warmer. And if the baby is before 34 weeks, sometimes the NICU team will be set up in the room next door. After the surgery is completed, it typically takes 45 minutes to an hour from start to finish. You will still be numb from the waist down, so we'll move you to a bed and take you to the room in which we started. This time we call it the recovery room. We will continue to monitor your vitals and bleeding, as well as your baby's color, to be sure the baby's getting enough oxygen, and your baby's temperature and other vitals. And we'll encourage you to take an hour skin-to-skin contact with baby and breastfeed the baby.
When do I get to eat and drink after surgery?
So you're going to get water in the recovery room. You can eat as soon as you're feeling up to it. We usually start with something soft and easy to digest, like pudding, and then as long as it stays down, you can have a regular diet.
When can my other support person see me and the baby?
So after you move to the postpartum room, your additional support person can be with you then. Let's see what that looks like. You will have a catheter in the bladder for 8 to 12 hours, and then it will be removed. The anesthetic block will wear off at 2 to 3 hours. You will need to have assistance getting out of bed for the first time. The lactation consultant might visit and help with nursing. A physical therapist might come and teach you techniques to move more easily with your incision and exercise tips for your recovery. Physical therapy is also available to schedule outpatient visits after you go home. And we encourage you to walk in the room and in the halls to decrease the risk of blood clot and as well as keep your intestines moving. Also, if you like chewing gum, you can bring your favorite type of chewing gum, and that helps to keep your intestines active as well.
How long will I be in the hospital?
Typically 2 to 3 days.
Should my support person stay the night with us?
We recommend that your support person stay overnight with you and the baby, and suggest that you room in with the baby so that you and the baby can bond and learn the feeding cues to develop a routine. We'll recheck your blood 12 to 18 hours post-op to evaluate for anemia, and we try not to draw your blood in the middle of the night unless it's necessary. Also, for the first 18 hours, the pain should be pretty well controlled with the medication that was injected through your spinal block. Around that time, the intrathecal morphine will be wearing off. You'll typically get routine non-steroidal anti-inflammatory medications like Toradol and ibuprofen, as well as scheduled Tylenol, and can have a narcotic medication as needed for pain beyond what the scheduled medications can relieve.
Do I need to let my pediatrician know that the baby's been born?
No, we can contact your chosen pediatrician for you, and they will see your baby within the first 24 hours after birth.
What else can I expect?
So your obstetrician and the baby's pediatrician will see you every day and work together to coordinate when you and the baby can go home and when you need to have follow-up appointments. After discharge, it's important to drink plenty of fluids and get adequate protein intake. Rest when you can, as babies typically don't sleep through the night for the first 2 to 3 months of life. Frequent breastfeeding is important so your baby gets colostrum. This also provides stimulation for your milk to come in around day 3 or 4. The lactation specialist will work with you and make recommendations on adding in a breast pump if needed. You can get a prescription from your doctor that should cover a breast pump through your health insurance company at the time of hospital discharge if you didn't get it during the pregnancy. Even after discharge, lactation consultants are available by phone or in person to evaluate the baby's latch and do a weight check on the baby. So hopefully we've answered all of your questions regarding your upcoming delivery and made it feel a little bit less overwhelming or scary. If you have any questions, please contact your OB/GYN's office. Congratulations on your upcoming delivery.
Awesome. Thank you so much.